Welcome to Dentist Puns and Money. I am your host, Shawn Terrell, and it has been a few months since our last podcast, more than a year. Well, not more than a year. So back today with an update on things moving forward. I want to cover three things in the podcast today. Number one, where I've been and why the podcasts have sort of been infrequent at best and non-existent since April of 2024. Number two, what the podcast is going to look like moving forward in terms of the format. And number three, the different topics we'll cover on the podcast moving forward in the near future. So let's start with number one, where I've been. So there has not been a podcast release since I think April of 2024. And prior to that, they were pretty infrequent for the last 9 months before that. And if you were paying really close attention, you probably saw that there was some repeat episodes released from the previous years. So this is the first podcast recording that I've done in more than a year. And the reason for that is in June of 2023, I had 2 strokes completely out of nowhere. The first stroke at the time seemed pretty bad, but in hindsight wasn't really that bad. The second stroke that I had, which came less than a week later after the first stroke, was pretty bad. Like I woke up in the ICU. That's how bad it was. And, probably lucky to still be here. Bad. So I'm back. I've been recovering for the last year, more than a year, 16 months, I think, since I had everything happen, and I'm ready to start podcasting again. So here we go. Topic number 2 is what the format of the podcast is going to look like moving forward, at least in the near future. And so I'm going to start off by just doing solo podcasts, try to keep them pretty short. So in the past, we've had guests a lot of the time, or at least some of the time, to talk about different topics within dentistry. But I don't think I'm going to have any guests on the podcast in the short term, just to kind of keep things simple and keep it easy moving forward. In the past, I have published about every other week, and I'm going to try to keep to that schedule moving forward, at least getting one out there every couple weeks or at least a couple of months to try to get some sort of regularity back with the podcasting schedule. And number 3, if you are watching on video, you already know this, but in the past, my podcast was audio only. As I sort of restarted here and refresh it, I'm going to put it out on video as well. So if you're watching on YouTube, thank you. If you're listening to the audio version of the podcast, as you have in the past, and you want to watch it on YouTube, or excuse me, you want to watch it on video, go to our YouTube page, which is just search for Dentist Exit Planning, and it should pop up on YouTube. And yeah, if you want to help out the algorithm, you could follow along as well. So that's sort of the topics as it relates to the new format moving forward. And number 3, what I'll talk about, the topics moving forward, I still want it to be focused on dentistry and how dentists should handle the financial component of exiting from clinical practice. However, I think I tried to do this in the past, but in light of what's happened to me in the last year or so, I'm going to try to really probably focus more on this moving forward. How do we weave in life to the financial component as well? Like, how do you want your money to intersect what you want out of life? And when you have a near-death experience, as I have had, and probably didn't call it that right away, but have gotten more comfortable calling what happened a near-death experience recently, I think it sort of forms your thoughts on how you want your money and your life to sort of intersect moving forward. And it's part of my story. So I think I'll try to weave those things together in what I talk about moving forward, at least in the short term. Everything subject to change, but that's kind of where I want to start and go with the first few episodes. Related to that, and I went back and forth on this one, I am going to talk about for the next couple episodes what happened to me in terms of my health and the strokes. And I don't know if I'll give you a complete play-by-play, but more detailed explanation or version of events than I'm going to do today. Just what happened, and I don't know if it helps anyone out there or not, but I went back and forth as to whether anyone would care or whether that was applicable to finances and money. But I also thought that, it's part of my story now, and I would want anyone that I work with moving forward to have a full understanding of what happened to me if they want to work with me in the future, just so there's nothing that they don't know about. And that might make some people not want to work with me moving forward, or maybe if I don't know how it make people feel. But at any rate, I want to tell my story. I want to do it in my own words. And I thought that my podcast would be the best place to do that. So if you don't care at all, I understand it's not related to money, or won't be much related to money the next few episodes. But if you do care and you kind of want to hear what happened, pretty open book about it, then the next couple episodes will be about that. And a lot of people, this will probably be a surprise to, because some people definitely know what happened health-wise to me in June of 2023, but a lot of people that have listened to the podcast probably do not know that. I'm going to lay it all out there in the coming episodes. So let me know what you think. Anyways, that's about all I have to say for today. Again, thanks for following along. And if you're listening, again, thanks for being a subscriber. And I will try to keep things moving forward in the future. Again, thanks for being here, and thanks for being with me on the journey. And I'm rambling now because I'm pretty raw at this. I haven't done it in a while. So we'll talk to you again soon.